Mitral valve prolapse syndrome has been undiagnosed more than misdiagnosed, but it has been both, and I'll tell you why. Undiagnosed because mitral valve prolapse syndrome comes in so many forms. It's a chameleon, and it can be something as simple as a palpitation, a heart fluttering, a little bit of fatigue, a little bit of anxiety, sometimes some irritable bowel. Generally have a good idea about cardiology. It's easiest diagnosed by a cardiologist, and now that we have echocardiography, the ultrasound tool, we're able to diagnose it more often. So before we weren't able to diagnose it. It's been misdiagnosed often because mitral valve prolapse was thought to be a lot of other things. People that had symptoms such as simple anxiety, a panic disorder, potentially a heart flutter, a palpitation, were often thought to simply have those and not to have mitral valve prolapse syndrome, which now can be diagnosed and then treated different than the other disorders that they were once thought to have been, making people feel not quote-unquote crazy, and giving them actually something to work with in terms of their treatment other than potentially the wrong disorder.
You touched on the importance of going to a cardiologist, but I'd like you to go a little bit further and tell me the importance of going to a cardiologist who either may have specialized or just had a lot of exposure on a day-to-day basis to mitral valve prolapse syndrome.
We used a five-prong approach in our offices. Specifically, we treat it different than most other cardiology or other practices in general because we've made it our mission. We have a mitral valve prolapse program with a book that we've authored and distribute to patients. We have a stress management tape that we have digitally formatted and give to patients. And we have a full-time mental health counselor who's licensed in the state of Florida and specifically treats mitral valve prolapse day in and day out. So you add that to the doctor's experience of having treated mitral valve prolapse for many years and being on the cusp of some new research and being in touch with Dr. Gaffney, who's a NASA astronaut, who we keep in touch with to learn about the new research frontiers, makes us very unique. We spend the extra time with the patient, and we learn how to, number one, educate the patient of their disorder. Number two, we tell the patient, we were able to reassure the patient, or tell the patient really what is their prognosis, and should they or should they not be worried, and that's extremely important to them in terms of their feeling better. We also then give specific nutritional counseling to make sure they're eating and not eating the right and wrong foods. We're also very vigilant in telling people how to exercise, giving them an exercise prescription, generally based on a stress test that we can utilize to have people exercise where they prior may have been afraid to or unable to. After all that's said and done, and they've gotten the fifth prong, which is stress management, specifically and individually with a counselor, a mental health counselor. After all of those things are done, those five major things are done, occasionally we'll need to use medication specifically designed for mitral valve prolapse. So that's why we're a little different than someone who just says, mitral valve prolapse, it's benign, we'll see you in a year. We take it very seriously as it is a serious disease. It's shown up in as many as 20 million Americans. As much as 20% of women between 20 and 30 years old, according to the Framingham study. Mind-boggling numbers. It just has not really been media alerted disorder, and now I hope it will be.
What advice do you have for that person, that woman or man who's going to their cardiologist, being told that they have nothing, continuing their daily life with these palpitations, with this difficulty in their life, but doesn't necessarily want to leave this cardiologist that they've had for years, that they think is probably knows what he's saying? How do you help a patient kind of break away, get a second opinion, and follow what I would think is going to the institute?
Excellent question, excellent question. What you need to do at that point is verify. Always verify. Don't take anything ever at face value. If someone says you don't have something that you think you have, get a second opinion. Make sure that the echocardiography, which is the most important test in diagnosing this, was done properly with maneuvers, under the right conditions, with the right machinery, with the right technician. If that has all been done and you're still sure that you have it, then get a second opinion. At that point, maybe you don't have mitral valve prolapse and you may have something else, and heed that medical professional's advice. But until you've done that, you may not know that you have something that is treatable very easily treatable, and you can live a healthy, productive, high-quality lifestyle without having the burden of medications or feeling like a medical cripple.
You mentioned earlier, and I want you to just kind of expand real briefly on the fact that it's very treatable and no one should have to go through, no one who has mitral valve prolapse should have to go through their lives with these problems. Can you just expand a little bit on how treatable it is and how important it is to get into the right treatment so you can have a good quality of life?
Absolutely. First of all, we expound on this a lot in our book, The Myths and Facts of Mitral Valve Prolapse, which is available through our office at 1-877-96-HEART or on our website at mitral.com. We have a full array of treatment options, varying everywhere from nutritional counseling and stress reduction to specific medications, and ultimately, and in the worst case scenario, and very infrequently, possibly surgery. So we have all the options. We're a full-on institute of cardiovascular care where our lives and livelihoods are dedicated to this. This is what we do. We're in the community, the South Broward and North Dade community for the long term. My partners have been there over 15 to 20 years. We've got probably 50 years of experience between us. We know what we're doing. We're committed to it, and we encourage people to come in so that we can help out with these quality of life issues, because ultimately it's not necessarily how long you live, it's the quality of your life while you're living.
My last question is, you are obviously working very closely with Dr. Gaffney and other experts around the country. What do you think is the future of treatment for mitral valve prolapse and the, I guess, exposure of the reality of this serious disease?
Great question again. I really think it's going to be cured. I'm trying now vigilantly to get research going. I'm publishing an article shortly with Dr. Gonzalez from the University of Miami about mitral valve prolapse, but we feel that this is an inherited disorder that probably has a genetic link. Therefore, it can be chromosomally analyzed, and we can figure out what chromosome it's on, and hopefully down the line do gene therapy or other specifically targeted therapy to cure this disorder. That's my hope, and I'm going to work diligently till